Hey guys, so today on Psychology 101, we're going to be talking about psychotherapy. And we're going to start with the 6 most frequently asked questions in psychotherapy. On to Kendall.
Thank you, Lindsay. The types of therapies include client-centered therapies, which is humanistic, with as much emphasis on the client as possible. Cognitive behavioral therapy, which focuses on thoughts and behaviors and treats individuals with bipolar disorder, etc. Existential therapy, which is part of the human existence approach, which focuses on the whole life experiences and manages existences. And dialectical behavioral therapy, which is problem-solving, acceptance-based framework. The types of psychotherapies that work best is behavioral therapy, specifically cognitive behavioral therapy, because it helps you identify unhealthy negative beliefs and behaviors and learn healthier coping skills. On to Matthew.
Kendall, how are you doing today?
I'm okay.
What have you come in here for today?
I've been very anxious in school and I'm looking for help.
Oh, okay. Have you thought about, spacing out your workload so you're not doing so much at night,
I should do that.
Yeah, maybe try getting some hours of sleep to, help you focus more in school. Have you tried other outlets like sports, hanging with friends?
I have, but maybe some other skills?
Yeah, that would be great.
Okay.
Thank you, Kendall. Now on to question 3. How does psychotherapy help? During psychotherapy, you learn about your specific issues and how your thoughts, emotions, and behaviors affect your moods. Therapy helps you learn how to take control of your life and respond to challenging situations with coping skills. Psychotherapy has been shown to improve emotional and psychological well-being and is linked with positive changes in the brain and body. The benefits also include fewer sick days, less disability, fewer medical problems, and increased work satisfaction. Now, on to question 4. Who seeks psychotherapy and who does the psychotherapy? You know what I mean. Psychotherapy can be provided by a number of different types of professionals, including psychiatrists, psychologists, licensed social workers, licensed marriage and family therapists, and others with specialized training in psychotherapy. The reasons for going to psychotherapy includes dealing with severe or long-term stress from a job or a family situation, the loss of a loved one, or a relationship or family problems, having symptoms with no physical explanation, such as changes in sleep or appetite, low energy, lack of interest or pleasures in activities you once enjoyed, persistent irritability, excessive worry, or a sense of discouragement or hopelessness that won't go away. A health provider is expecting you have or diagnosing you with a mental disorder that is interfering with your life, supporting a child or family member who has been diagnosed with a condition affecting their mental health. On to you, Lindsay.
Hi, Matthew. What have you came in here for today?
Because I have anxiety.
In what cases do you have your anxiety?
When I'm taking a test and stuff.
Do you prepare for your test?
No.
I think you doing the preparation for your test and maybe studying a couple days before or even just a little bit the night before will help you so then you can, know that you got your test when you take it. In what ways do you have your anxiety?
My hands shake and I lose the ability to breathe.
Well, I can give you some stress toys to use while you're taking your test so then you don't have to focus so much on your hand shaking. And I'll give you some breathing exercises to do while you're taking your test so you can, calm down and focus on what you're doing. All right. Thanks, Matthew. On to question number 5. What are some important ethical features in psychotherapy? There are 5 main ones, and they are autonomy, justice, beneficence, non-maleficence, and fidelity. These are vital in having a good relationship with your therapist during your psychotherapy session. Number 6, what are drug therapies? There is pharmacotherapy, and it is known to be a drug therapy, and it utilizes more than one pharmaceutical drugs to improve ongoing symptoms of another. And they're effective in evaluating the drugs. Efficient can be accessed accurately only in the ideal conditions are selected by proper criteria and strictly adhered to the dosage schedule. So it only works to evaluate the drugs if you're on a constant schedule and following what your therapist has told you to do. Under expert supervision, a group of patients is most likely to have a response to a drug, such as the controlled clinical trial. On to our therapy sessions.